does IVF take? Generally, it is not fixed for each patient. The duration of the treatment will be differing for each patient. So, for example, if the patient is having adequate time before treatment, it is essential to prepare the gonads before treatment. That is, it takes around 3 months to prepare the eggs or ovum, particularly necessary for that treatment. So generally the egg inside the ovary or the spermatova in the testis will start growing 3 months before it comes out. So if the patient is having enough time, it is essential to supplement with antioxidants and to tell them to have certain lifestyle modifications to avoid junk foods and intake of good antioxidant rich vegetables and fruits, and to have proper sleep and to avoid stress. Then the main part of this treatment starts with the date of menses. So with the date of menses, we'll be giving injection gonadotrophins for approximately 10 days. And in between the duration of this gonadotrophin administration, we'll be doing ultrasound to monitor the growth of the follicles. And after the follicles matured enough, we'll be posting them for oocyte retrieval. And this procedure generally takes within 2 weeks. After retrieving the egg will be injected with the sperm for subjecting into ICSI, and for the growth of the embryos, it will take another 3 to 5 days. So if the patient endometrium is good enough and if the patient is fit for embryo transfer, we will be transferring for fresh embryo transfer after the 5 days of the egg retrieval. If the patient's endometrium is not suitable enough for fresh embryo transfer, then she will be having her own menses. After that, we will be start preparing her endometrium and will be subjecting to frozen embryo transfer. So it will be done in another menstrual cycle, not in the previous menstrual cycle. And after the embryo transfer, there will be 2 weeks waiting period to get the beta-HCG result. So for a fresh embryo transfer, the duration probably will be 4 weeks, but for the frozen embryo transfer, the duration will be a little longer. Thank you.